Hello. This is a brief introduction to the East Multicenter trial titled Scanning the Aged to Minimize Missed Injury. The elderly constitute the fastest growing population in the United States and represent a growing proportion of trauma activations. But current diagnostic imaging guidelines after blunt trauma are not validated in this population. So, in other words, when it comes to the elderly, we don't really know who needs CT scans and whether these should be selective or whole body. To address this knowledge gap, we aim to derive a simple and highly sensitive clinical decision tool to guide imaging decisions in blunt trauma geriatric patients. Additionally, we aim to identify geriatric patients who would benefit from targeted rather than whole body imaging without increasing the risk of missed injury or other adverse event. Our study is a prospective observational trial. Data for each qualifying subject will be collected at 2 time points. First, upon presentation to the trauma bay with only the information known at the time, and later after discharge. We're investigating patients aged 65 years or older who sustained blunt trauma, patients younger than 65, those who experienced penetrating traumatic mechanisms or burns, and those who did not trigger trauma team evaluation are excluded from this study. Once the data is collected and analyzed, we hope to establish a decision tool that will guide imaging decisions for geriatric blunt trauma patients. We anticipate that our data may help standardize future imaging protocols to minimize the risk of missed injury and optimize resource allocation, especially for our most severely injured geriatric patients. To participate in our study or to learn more, contact Vanessa P, Principal Investigator, or Sami Kishawi, Co-Primary Investigator, at the listed email addresses. Thank you.